All right. Good morning. We are with Dr. Miquel Damas. I'm going to read a short disclaimer and then we're going to go right into our subject today, which is the length of time the Coimbra protocol is and the results that we should expect to see in the time period for which we are doing the protocol. This interview is from our own personal experiences, and we are not talking in specifics, but in generalities, not referring to any particular individual cases. We are not giving medical advice. Medical protocols and methods of treating should be done by a licensed medical professional. Good morning, Dr. Miquel Damas.
Morning. How are you?
I'm doing well.
Fantastic.
Doing very
Fantastic.
well. We often see a lot of questions about the length of time the protocol is, and I'd like you to talk about that today and talk about maybe what we should expect as we begin to heal.
Yeah, of course. So that's a very good question, and I would say that's one of the very few questions all my patients ever ask me is how long does it take to complete the protocol? How long is the treatment? And then when can we or should we expect to see results? But these are two different answers. So the first question is, what's the length of the treatment? And up until now, there is no dead end. There's no point in which we can say we can stop. And the reason is, if you go and watch one of the few or the first videos that we did, the whole thing about the Coimbra protocol in terms of the way it works is to make sure that we can overcome the biological effect that genetical resistances have in the vitamin D metabolism in order to achieve its maximum biological effect, and with that maximize the immune system or optimize the immune system, which hopefully will lead to decrease in autoimmunity. And up until now, it's not possible to change the DNA. Maybe in the future it will, but right now it isn't. So because your DNA will remain the same, you still need to have those high dosages of vitamin D to overcome all the resistances. So because of that reason, there's no end to the vitamin D, because in theory you will always need to take the high dose of vitamin D to overcome all the resistances and make sure that your immune system is working as well and as good as possible. Now, lately, what we are seeing is that patients that have been on the protocol for a long time and they have a very serious control over their stress levels, especially emotional stress. We have some cases that we are being able to reduce the dosage of vitamin D, maintaining the good clinical outcome. However, this is very early, and we are talking people that are on the protocol already for 5, 6, 7 years. So it is possible that in the future, we know which people may reduce the vitamin D and when, but right now we don't. We can say it categorically. So the right perspective that a patient should have in terms of the length of the treatment is indefinite. There's a lot of variables into it. There's a lot of things that can be done. I have a lot of patients doing a lot of different things to after spending a long time in the protocol. But that's the right perspective. Now, that leads to another question, which is, what about the 2-year mark? Because there's always a discussion about the 2-year mark. What is the 2-year mark? Does it mean that the protocol will end after 2 years? And the answer is no, it will not end. What the 2-year mark means is that it is what I call the most active part of the Cunha protocol in terms of the medical support and medical adjustments that should be made. During the first 2 years of treatment, we will be able, in most of patients, we will be able to understand how the system works in that specific individual. What is the level of resistance? What level of vitamin D we need to maintain efficacy? What's the level of safety, calcium, kidney function, and so forth. So if nothing happens, or if nothing changes, or in other way, whatever changes in the first 2 years, we'll address it. So when we reach the 2 year, we are able to enter like a cruise control phase in which we know the dosage that the patient has to take. We know the patient knows very well the hydration and the dieting and everything. So it's after that 2 year period, my patients usually we have yearly appointments, some of them bi-yearly, some of them want to have more strict control. That's perfectly fine, but it's it's already on a cruise control level. So that's a 2 year mark. The treatment won't stop at 2 years. It just starts a new phase in which we already know how the system works. So yeah, the length is a question mark. I suspect it won't be a question mark in a couple of years. We'll have a lot of data on patients that are doing for a long time, all the measurements and MRIs that may be done to confirm that they can sustain good immune system status and good immune system, immune function without depending on high levels of vitamin D. Then you ask the second question that you ask is what about changes? What about improvements? What about what is the patterns that we or patients should expect to see um, in the Cunha protocol? And well, I would say for every person that starts the Cunha protocol will have a different pattern. But there seems to be like a few, three different or patterns, I would say. So the first one is patients start to get better, and once they start to get better, they keep getting better. That is obviously the ideal situation. I would not say is the most common, but it's quite common. So once the vitamin D kicks in the right dosage, in the right biological effect, it then goes and depending on each person, the length of the symptoms, the damage that was done, the length of the damage that was done, it will keep improving, and that keep improving, just like the protocol itself, doesn't have a dead end. Before we start recording, we were discussing these, and I shared a story about a patient that I have that's without, just for the record, without disclosing who the patient is or any of his or her data, but she after the she's almost on the third year, finishing the third year of the protocol. She started in May 2018, but she has the disease for 20 years. And she almost more than tripled his or her ability to walk after 20 years, which is pretty significant. So, and there's no way to say when the improvements will stop. I mean, after being doing the protocol for so long, I just gave up guessing. I just sit and wait and watch. I've seen people getting better. Yeah, for this, I think this case would be the the most extreme in terms of length of the disease and improvements.
Can I interject something?
Mm-hmm.
People often get discouraged because they see people on the Facebook groups, the social media, getting better at 6 or 8 months or 9 months.
Mm-hmm.
And, they may be at 16 months and they have nothing. And I can personally testify that I got better after 3 years. And that now I continually see slight improvements. They're
Yeah.
very, very slight, but I'm seeing improvements. That surprised me because when I started, I thought I was under the impression that at 2 years, everything that was going to improve would be improved. And
No, no,
that's not what we're seeing at all.
yeah, no, not at all. Not at all. I have a few patients that only got significant improvements after the 2 year mark. So I let me just make here like a detour to stress again that any improvement is an improvement. It doesn't matter how big it is from a success point of view or from a biological point of view. No symptom in multiple sclerosis, unless it is a relapse, but no symptom should get better. In theory, in
Right.
theory, that's what's supposed to happen. So when we discuss, and that's gratefully, that's the vast majority of my patients, in my points, we discuss how much better they are, not how much worse they are. So what we are discussing is getting better. That's one thing. The amount of improvement, it is very, very individual. It depends massively in the length of the symptom. So it is dependent. We believe it is dependent on the amount of damage that was done and how likely it is that the damage is caused by a scar. If it is caused by a scar, we won't be able to reduce it. There's no way to say that we will be able to renew the brain in case of multiple sclerosis, despite good data that's been coming out of a few experiments on dieting and some supplements that's pretty in mice and so forth. So what we are discussing here is when should a patient expect to see improvements. Truth be told, patients should expect to see improvements in the first 2 years of treatment. Most patients start to feel a difference between the 6 and 9 month mark. And the reason is, following my timeline and my protocol with the way I approach it and Professor Cornell approaches it, we should have our second appointment around the 4th, 5th month. So in that time, we will check the blood analysis, obviously, safety and so forth, and we will adjust the dosage of vitamin D. That's 90% of patients, more than 90. Vast majority will need an adjustment. And vitamin D needs 2 to 3 months to increase, stabilize, and be effective. So if you put those 5 months with 2 to 3 more, that's around 7-8 month mark. So that's when most people start they feel benefits up until then. It doesn't mean that everything will get better, will need to start getting better or being better by then. No, it means that the system starts working in that way. So that is the pattern in the patients that start getting better after a certain period of time. Then we have the pattern of people that they are just up and down like a roller coaster. They get better, they get worse, they get better, they get worse. Most of them, if we would kind of draw a line, like an average line, they get better, but it's like this. It's
Oh
like
my. And
like a
is it
radio wave.
Let me interject something here. It is extremely difficult because you feel so good one day. You can feel on top of the world and you can feel like screaming at the top of your lungs. It works. It works. Oh my God, it works. That's what I wanted to do. Then the next day, I felt as bad as I've ever felt. And I felt that I was worse. I wasn't really worse. You just feel worse because you felt so good. That's what I tell people all the time. Are you worse? No, you're not worse. You're just going back to where you were. And you feel good. I kept a schedule. I could feel good one day, and then it might be 2 weeks before I'd feel that way again. And that was extremely difficult.
And I can imagine the, not only difficult but frustrating, I would say. Um, and I would love to give you a straight answer why it is. I cannot. What I can tell you is much likely changes in the level of inflammation on the lesions. Um, and if we think about it, then the hypotheses are huge, huge. I mean, not physical changes, too much exercise, too much heat, hot showers, obviously stress, physical stress, emotional stress, infections, gut changes, diet changes. I mean, the list goes on and on and on. Um, Most of the times, there's no point in trying to go down the list and see what is the cause, because most people will point to the cause themselves, whatever it is. But these that I just referred to are the most common ones. And you don't need to have a significant infection. For instance, you may just have a minor infection. You might just go to the gym or rehab, physical rehabilitation, and you just pushed a little bit too much on the exercise, and next couple of days, 3 days, you are off, because that will increase inflammation. It will impair your function. Obviously, if you start feeling worse, your mental strength also reduces, which will impact the, the inflammation levels and the symptoms. So that's important for people to understand, that if they are getting better and worse, it means that they are getting better, because the bottom line is staying on the low side. And it shows. I understand it is, and I understand also that I'm talking from a place of not knowing exactly what it is, and I understand that. But the way I try to put it to my patients is, if you're getting better, it means that you can get better. It doesn't mean that you will get better. It means that you can. And
What I tell people in the beginning is if you see a change in the beginning, it might be so slight, but maybe you can raise a finger, or maybe your speech gets better, or maybe something gets better.
yep,
And it might be so slight, but it shows that it's working. And it
yep,
gives you, in the US, they'd say it gives you fodder for things to come. For myself, fortunately, I got better after 31, 41 days. I had a spectacular day or week. All right. Now, after that, I went back and I had some terrible days and months, but I always knew that it worked. And I just need to be patient. And that's a lot of it, is just patience, patience, patience.
yep. Yeah, that's an important point. Yeah,
Yeah.
these um, it takes time. No one should expect to treat something that took years to develop in days. Those I wish it would happen, but it just doesn't. I mean,
Yeah.
I do have patient. I have a patient that got better in 3 weeks and never went
Wow.
worse. I
Wow.
have patient that took years to get better. So on average, we are looking. It's reasonable to expect differences to start at between months 6 and 9.
That's exactly what I tell people. Usually between 6 months and 9 months,
Yeah,
you see
it
something.
it depends on two factors. One, obviously, when do you do the adjustment? What your doctor plans for you? What is the actual timeline of the treatment for you? And second, how close the initial dosage or the previous dosage is to the ideal dosage. So imagine that someone's ideal dosage is 60,000 international units per day, and they start with 50,000. I mean, it's it's very likely that they will start having improvements from the get-go, because 50 and 60, they are very close. However, if the ideal dosage is 200,000, it's very unlikely that 50,000 will make any significant effect, nor the doubling the dosage 100,000. So it's a lot of different variables that come into it that people usually don't realize when they just listen to the feedback and the incredible stories that exist. But when something change, it is good because um, it's not stiff, it's not set. And then there is a third pattern, and the third pattern is people that get worse before they get better, and they exist. There are not that many. Uh, I have an extreme case of someone with rheumatoid arthritis in the Netherlands. He was on 3 anti-inflammatory pills. He could not ride his bicycle, and in the Netherlands, that's a big thing. And for the first 6 weeks of the treatment, he got worse. He got significantly worse. But after 6 weeks, and in the time span of a week, he got so much better. He got so much better that he was able to ride the bicycle for 150 kilometers per weekend, which is not only a very incredible recovery, but a very lengthy period of time of worsening. So these are the three. In this case, when someone has a worsening, obviously it needs to talk with the doctor to monitor it, to see whether or not, or what type of worsening it is, what is the cause. We had Professor Quimmer calls this the false relapse, or reheating of lesions. So it doesn't mean that anyone is getting a new relapse, but it's just old lesions that are getting more active because of the whole process. Yeah, so these are the three patterns that we see. Um, Again, people need to be patient, and most patients have been patient for a long time before starting the protocol, and they want desperately to see results. Hopefully they will come. Hopefully the vast majority of people will see improvements as soon as possible, but it is a very long game. And as I tell my patients, I want them to be better in 2022 rather than when comparing it 2021, and then 2023 will be better than 2022, and so forth. So that is the whole plan. That is the whole explanations on what people should expect in terms of time and the time span of the treatment, the improvements, and all those questions.
Well, thank you very much. I don't know. I don't have a subject for next week. Um, uh, I
Yeah,
think
so
we ought to,
people should text us, send an email, my
yes.
patients or anyone's patients or anyone curious on the treatment. Just text us or email us, and
Yeah,
we'll
we try to lump them together, and like if
Mhm.
it's a common question, I try
Yeah,
to answer
exactly.
that. So we'll do that maybe